Thinking about treatment for bipolar disorder, there are, again, different areas that we think about, including medication, psychological support, potentially lifestyle adjustments. Medication, the aim with medication for bipolar disorder is to stabilize people's mood. So bipolar disorder can cause differences in the levels of dopamine and serotonin in the brain, which are two chemicals which regulate our mood. Mood stabilizers act to stabilize the level of the dopamine and the serotonin in the brain so that our mood is steadier, is more stable, and so that we're not experiencing significant fluctuations either with our mood being elevated or our mood being depressed. These generally need to be taken over a longer period, often for many years, to ensure that people do not experience further episodes of illness. They should always be monitored and reviewed regularly, and we always want to make sure that any treatment that is taking place is the right thing for that person at that time. And the aim with medication treatment for bipolar is to reduce the frequency and the intensity of those moods so that people feel that they are in the middle with their mood and settled much more of the time. So that is where the name mood stabilizers comes from when it comes to medication relating to bipolar disorder. That can be a number of different medications, and it has to be a specific choice because there are some restrictions around particular medications, so we have to make sure that it is the right medication for that person at that time. Thinking about possible side effects for mood stabilizers in bipolar disorder, the most common side effect would probably be that of sedation. So quite a few of the mood stabilizing medications can make people feel more tired. That might mean that their energy levels are lower or that they just need more sleep. Sometimes the medications can make people feel a bit more restless or a little bit shaky, and occasionally it can have an impact on appetite. But broadly speaking, mood stabilizers are relatively well tolerated. Regarding side effects, any medication can cause just about any side effect. And the important factor is that if you are experiencing side effects from medication, to discuss that with a health professional, because we need to make sure we are striking the right balance for you. You are getting the benefit out of the medication, but without side effects that are so troublesome that they also are having a negative impact on you. So thinking about side effects, the main things to look out for are sedation, changes in energy levels, potentially changes in appetite, but I would just really encourage communication and conversation around anything that you think might be a side effect. In terms of psychological support, that varies somewhat depending upon the person's current symptoms. The main role of psychological support really falls with either when people are feeling relatively stable or when their mood is low, because it is typically much more difficult to engage with a psychological therapy when somebody's mood is significantly elevated. Cognitive behavioural therapy will often be helpful for people who are experiencing a depressive episode, thinking about strategies to improve mood through the experience of different emotions, different thoughts, and our physiological response to those. So CBT will help with treating the depressive episodes. And it may also be that some psychological support when people are feeling well can be helpful in the form of helping to identify early warning signs that people might be becoming unwell, or to make sure that people have strategies in place to reduce the chances of further illness. Thinking as well about lifestyle. Sleep is a particularly important factor when it comes to bipolar affective disorder. And in particular, maintaining a routine around sleep and making sure that people are getting enough sleep, we know is really important. But also maintaining a social network, making sure that we have people around us who we enjoy spending time with, but who also can provide us with support when we need it. So that's an overview of the different treatment approaches for bipolar disorder, including medication, psychological support, and lifestyle. Finding the right mental health professional when treating bipolar disorder is really important because you want to make sure that that person has experience in managing bipolar disorder, that they are able to identify the different symptoms, that they are able to provide you with the correct evidence based treatment, which may be medication, maybe other approaches. It's also important that you have somebody that you feel you are able to communicate with, that you are able to explain your experiences to, say that this symptom is a bit worse, that I've got this side effect, that this thing is more challenging for me. And that person will then take that on board and potentially adjust things with you, make a slightly different plan, arrange to meet with you at an appropriate timescale to make sure that you are getting the right treatment so that the chances of a further episode of illness are significantly reduced and that you can carry on living your life the way that you want.